Good afternoon. Welcome to Wellness Wednesday with New Mount Calvary. Today, I have the pleasure of interviewing one of the best doctors in the world.
That's so sweet.
I may be biased, but oh well. So, allow me to introduce to you all Dr. Charmille Hare. She is the primary physician at Piedmont Family Physicians in Locust Grove, right near Tanger Outlet. So, she is easy to find.
Oh yeah.
If you are in need of a primary physician, please contact her office. She has new patients appointments available right now. So please check her out in the Locust Grove area. So today we are going to be discussing hypertension with Dr. Hare.
Yes, ma'am.
So, Dr. Hare, first question for you.
Yes.
What is hypertension?
Well, hypertension, or the other name would be high blood pressure. All it means is that the pressure that comes out of our heart is elevated. So normal blood pressure would be anything less than 140/90. But if we start seeing a blood pressure stay greater than 140/90 on a consistent basis, that equals high blood pressure. And there's more than one type of high blood pressure. So people just put everything in one big basket, but there are actually two types. So there's primary hypertension, which is, we don't really know why people get primary hypertension. It tends to run in families, mom and dad, to give it to you, thank them for their genetics. Or there is secondary hypertension. And secondary hypertension is usually due to something else. Now in the society we live in, a lot of people are overweight. So weight can be a factor, diet can be an issue. It can be because of something going on with your kidneys or some other chronic health condition that then contributes to you having elevated blood pressure. So that's known as secondary hypertension. So we have primary, and that's just, we don't know why you get it. And I've seen patients as young as 18, 19 with very high blood pressure. And then, we have secondary, which is usually due to something else. Oh, I forgot to mention, obesity is one, sleep apnea is another. So there are other conditions that can lead to hypertension, and that's known as secondary hypertension.
Very good. Very good.
Mhm.
Now, can you tell us how hypertension is actually diagnosed?
Okay. So how we typically diagnose it in the office is I have to have at least two blood pressures greater than about 2 weeks apart to equal diagnosis. So if I see you the first time in the office, the only exception to that is if you come to me first time, you're not aware, and your blood pressure is greater than 160 on the top or greater than 110 on the bottom, you most likely have high blood pressure. It's very unlikely that that's just because you're nervous or upset, okay? So in that case, I'll usually say, I believe you have high blood pressure. If you want us to recheck it, or you want to check it at home, and then we follow up, we can do that. But most likely, based on how high it is today, you more likely do have it. Now, for some patients, if their blood pressure is like greater than 140/90 one time, and it's first time coming in the office, I'll usually say I have to have two blood pressures greater than 140/90 2 weeks apart. So I'll have you go home, check your blood pressure a couple times that week, and if it's consistently greater than 140/90, when you come for that 2-week follow-up, you do actually have hypertension.
Okay.
Mm-hmm.
All right.
Mm-hmm.
And at that time, would you generally start them on medication?
Absolutely, absolutely. You have to remember the reason why we need to treat high blood pressure is because it causes damage. So we would normally start treatment. But the way I approach medicine as a whole is I think in more of a preventative way. And so I'm not just going to say, well, here's some pills, good luck.
Mm-hmm.
We're going to actually talk about lifestyle. We're going to talk about diet. We're going to talk about how active are you? What are you eating? Are you carrying any extra weight? And if you lost that weight, would that help with the blood pressure control? But in the meantime, while you're making all those changes, we can't leave the blood pressure the way it is, because whether you feel it or not, it's causing damage. That's why hypertension is also known as the silent killer, because you don't feel the symptoms from it. You're living your life, running around, doing whatever you do, and that blood pressure is staying high. When you feel symptoms, that's usually because it's causing a problem.
Right.
A lot of times people run around with blood pressures high and don't even feel it. So that's why it's so important to go to the doctor at least once a year for preventative maintenance.
Right, because a lot of times, do the body, after, if someone been having high blood pressure for a while, the
Mhm.
body kind of adjusts to that,
Absolutely.
and it becomes their new norm.
Absolutely. And I think that's the thing I see a lot in the office is a patient will say, oh yeah, I was told I had high blood pressure a while ago when I went to this doctor's office, but you know, they didn't tell me anything, or I didn't go and follow up on it, and I've been feeling fine, but they show up in the office that day and the blood pressure is 180 over 120, and they're like, I didn't even know it was this high. What happens in the beginning, your body always warns you when something's wrong. We tend to ignore the signals. So you start off just having some headaches. Oh, my head hurts a little bit today. Or you feel fatigued. Or your chest feels a little tight. But you'll come up with excuses for why that's happening. Oh, I have a headache today because the day was stressful. Or, oh, my chest is tight probably because I have some indigestion. We'll come up with all kinds of excuses for why those symptoms are happening. And then time will go on and your body will adapt and say, okay, well, I guess this is where we're going to live. So this must be the new normal, and it will adjust, and those symptoms will ease off or sometimes even go away altogether. But your blood pressure is getting higher and higher over time. So you can't use how you feel as a reason to tell you, well, my blood pressure must be fine. I have patients tell me that all the time. I feel great. Well, that's great for you, but that blood pressure don't like that.
Exactly.
So we can't just go off how you feel. We gotta also do some science behind it too.
Correct. Okay, very good, very good. Well, you kind of talked about this a little bit, but what are some of the risk factors for hypertension?
So one of the risk factors we know is definitely genetic propensity, meaning that mom and dad, somebody in the family has it. So one of the first things we do when you come in the office is we ask you, tell us about your family history. Tell me about mom, tell me about dad, tell me about your siblings, grandma, grandpa, whoever. Does anybody have high blood pressure? Does anybody have heart disease? Does anybody have kidney failure? Anything like that. So we want to look for possibilities of genetic propensity. So that's the first thing we look for. Then, of course, we look at you as a patient. So we look at your propensity and we look at you as a patient. Are you a smoker? Do you drink a lot? Are you overweight? And we're not talking about a little overweight. We're talking about significantly overweight, a BMI greater than 30. So what I mean by BMI is we take your height, we take your weight, and we come up with a number. That's body mass index. That tells us pretty much in essence what number you are at. If your BMI is greater than 30, then your weight could be contributing to your blood pressure being high. So we look at that as a factor as well. We'll also look at other health conditions that could lead to this problem. Patients who have kidney disease and unaware, patients who have obstructive sleep apnea have uncontrolled blood pressure, even on sometimes 1 or 2 medicines, have a hard time controlling the blood pressures. And then there are other rare conditions, patients who are anemic. Sometimes if your blood count's low, your body will try to get that blood to your brain, and so the pressure will be high. You have some patients who have all kinds of health conditions, rare conditions like pheochromocytoma. It sounds like a big name, but your body's secreting adrenaline, and so your blood pressure goes high, and then it drops, and then it goes high, and it drops. So all kinds of health condition, a thyroid condition. I mean, the list is long of all the things that could lead to blood pressure. But that's why it's so important to go at least get checked out once a year. We check your kidney function, we check the blood pressure, we weigh you, we do labs when you come for a physical once a year, and that's how we kind of get the lay of the land to see, okay, what could be contributing to this problem, and then we can give you a solution based on the information we know.
Awesome.
Yeah.
Awesome. Question that a lot of people ask, and some people take upon themselves, but let me ask the person who went to school for this, is it possible to come off of your blood pressure meds once you're started on the medication?
So the answer is yes. And I'll put a little tiny no, okay? So let's start with the yes. So with the yes, I would say if your high blood pressure is due to secondary causes. So let's say your BMI is 40, or you eat a lot of salt, or you eat very poorly, or you do not do any exercise, you're a couch potato. Any of those factors could contribute to your blood pressure being high. So if we correct those problems, a lot of times we will just start the medication, and then as you correct these problems, we start noticing that, oh, my blood pressure is running lower on the blood pressure medicine, let's wean it. Now, here's the disclaimer, okay, Lakeitha? The disclaimer is do not just stop your medicine without talking to your doctor. And I've had patients say, well, I tried this herbal supplement, so I'm done with blood pressure medicine. I'm doing my apple cider vinegar. I'm not doing blood pressure medicine. We have to be a team. This is why I think it's so important to look for the primary care doctor that you trust. Somebody you say, I have confidence in. It's not about who's the best doctor. It's who's the doctor you feel like when they talk to you and say something to you, you say, I trust what they're saying. Because if you trust them, y'all can have that conversation, which is, look, doc, I really don't want to be on blood pressure medicine. And they'll give you an honest answer. Well, I think you could. But that means you're going to have to be very dedicated to losing weight. That means you're going to have to exercise 150 minutes a week. However you want to split that up, 30 minutes 5 times a week, 3 times 45 minutes, however you want to do it. You got to give me 150 minutes a week of cardiovascular exercise. You're going to have to cut out the salt in your diet. You're going to have to lose weight. That's the kind of conversation we need to have. I can help you do it, but you're going to have to do the work, and we're going to have to work together and communicate. Oh, doc, my blood pressure's running 105 over 60 something. Oh, sweet. Let's cut that pill in half. Let's, cut it down and then continue to monitor it. So it's going to require teamwork. Unfortunately, that's not what happens in most cases. People just say, well, I'm tired of taking this pill every day. They stop taking it. And then unfortunately, it's not until they feel something and they rush back into panic. Oh, my blood pressure's high. And it was just not necessary. And so, yes, I do believe it. And have I done it? Yes. I have patients who have blood pressure issues because they are anxious. They have an anxiety issue that's never been diagnosed. So they're on 5 pills. I had one patient who was on 5 or 6 pills. And we were able to reduce her to 1 or 2 pills. But that was because she had an anxiety disorder that had not been diagnosed. I've had a man who was on 4 meds, came off of all his medication because he had an anxiety issue. We were diagnosing him and treating him for just the blood pressure. We weren't dealing with the anxiety problem and the lifestyle. So we did all of it together, and he was able to come off the medication. But the whole point is that has to be a discussion. It can't just be, well, I'm tired of these pills and I just don't want to take it. Because that causes damage.
Right. And so before we go to my last question on hypertension, I want to throw this out here to you.
Okay.
Doctor.
Okay, like hey,
doctor friend. So in our community, people tend to, like, say for instance, they'll just say, oh, I think my blood pressure up. Let me go ahead and take a little mustard or a little vinegar. Can you please tell me what is your input on that with the mustard and vinegar and bringing down the blood pressure? Please, doctor.
Well, I mean, what I would say to you, Lakeitha, is there are some herbal remedies that really do work for blood pressure. The problem with that theory is you don't know why you have high blood pressure. So if you are using a generic treatment for something that you don't know the specifics of, I think that's a problem. I think, in life, we want things to be tailored to us, but then we want to use everybody else's anecdotal experiences to treat something that is life altering. So if I have high blood pressure and mama and them use mustard, mama and them use vinegar, but all of them have had heart attacks and strokes, I might need to think twice about the fact that I may not need to be using that mustard. If it's worked for them, if you have a genetic propensity, you just don't know what the cause of your blood pressure is to just do something generic and hope for the best. And in my experience, a lot of people who do that don't check their blood pressure regularly. What they do is they say, oh, I can feel it high, so I'm just eat some mustard, and then the feeling goes away, and then they feel fine. And I have an aunt who does this for a living. She actually does treatment using herbal supplements. She went to school for it. She's very, very smart. My aunt's like a genius, okay? And I remember years ago when I was actually working in Barnesville, I called her and we're having a long conversation, and I was asking her, hey, auntie, based on your experience, like, what herbs should I recommend to patients? What kind of things should I recommend to patients? And this stuck with me from somebody who works in that world. Okay, she said to me, look, Charmille, if you don't make the lifestyle changes, if you don't make the dietary changes, if you don't do the lifestyle stuff, it's just a waste of time giving patients these herbs. And she said, I tell every one of my patients that I treat with herbs, if I'm going to do a situation that tailors you, I still have to evaluate you. You're not going to call me in my office and say, hey, I need herbs for high blood pressure. And I say, okay, I'm just going to randomly throw out some herbs to you. I'm actually have you come in. We're going to talk about your lifestyle, your diet, the things you're doing. We're going to do some tests, and then based on that, I'll recommend herbs based on that information. She's not going to give you generic answers. And so that made me realize that she said, so even in medicine, I don't believe in traditional medicine, she said, necessarily for everything. She said, but there are things where it's necessary.
Right.
And in those things that are necessary, it's the same steps you take are the same steps I take. I make them, diet, exercise, do all the things that you tell them to do, and then add the herbs to it. So no matter what you have to do, you still got to go to the doctor.
Right. Right.
No
You
way
guys
around
hear
that.
Don't just treat what you think is high blood pressure
Correct.
with mustard and vinegar.
Yes.
Go to the doctor
Go
and get
to
an
the
actual
doctor.
diagnosis,
Get diagnosis.
and the appropriate treatment.
Yes.
Okay, with that being said, I have one last question, Charmille, which basically, I'm sorry, Dr. Hare.
Oh, girl.
It's
It's my sister, y'all, so that's how we talk outside of this situation.
That's right. So with that being said, this comes to the more serious side, I think. What are some of the complications that are related to hypertension? I think people need to hear this because hopefully it'll make them take it a little serious when you talk about hypertension. But
Yes,
can you
ma'am.
kind of discuss some of the complications that are related to hypertension?
So with hypertension, we mentioned that it was a silent killer. So a lot of times you'll have high blood pressure and not know it. There's already been years of damage and you're not aware. So we care about the major organs being your kidney, your heart, your brain. And unfortunately, hypertension affects those three organs significantly. If you do not treat your blood pressure, it can lead to kidney failure. And over time, that kidney damage leads to dialysis, or even some patients have to have a kidney transplant. And so that's the first area, is that your pressure filters through the kidney. And so if you're pounding that kidney with blood pressure, it will eventually start to affect the effectiveness of that kidney, leading to kidney failure and eventually dialysis and eventually possibly a kidney transplant. So that's the first organ. Second organ is the brain. And that one we probably know more about, like patients who have strokes or even mini strokes. And I have a family member who has started out having little mini strokes, didn't make the lifestyle changes necessary, and had so many mini strokes over time, eventually had one big stroke, and then end up leading to a form of dementia known as vascular dementia, which is her brain had been damaged by so much loss of blood and so much damage to the small organs in her small blood vessels in her brain that now her memory was affected. So now she had dementia, and this is not Alzheimer's dementia. This is vascular dementia. That means from you stroking so many times in the brain, now you can't think properly. And so you have symptoms like dementia, but it's due to poor blood supply to the brain. So stroke is not the only complication. You can have stroke, you can have a mini stroke, and then of course, over time, it atrophies the brain, meaning it shrinks the brain and affects the functionality as you get older. So that's a problem too. And then the last organ, which is the most important one, is your heart. You don't have a heart. Your heart don't beat. There's no blood circulating. You're not here. And we hear of young people in their 30s having heart attacks and dying. And most likely there were warning signs before they had to have a heart attack in their 30s and die. They probably never went to the doctor. They were proud of it. And then, boop, have a heart attack and pass away. So heart attacks where they just, they can leave here. Some patients will have a heart attack, but unfortunately the damage is so much that now they lead into heart failure. And you can have heart failure from a heart attack. You can also have heart failure just from chronic uncontrolled blood pressure for a prolonged period of time. And the walls of your heart start to thicken, and that leads to the heart not pumping efficiently, and that is known as heart failure. So uncontrolled blood pressure can cause a heart attack. It can lead to a heart failure. It can lead to abnormal rhythms because the heart wall now is abnormal. So the circuitry that goes through your heart gets altered, and then you start having what we call palpitations or abnormal heartbeats and atrial fibrillation and all kinds of other issues. So blood pressure really has a lot of complications. I didn't even mention the eyes. It can damage the vessels in your eyes. Sometimes the eye doctor can look in your eye and say, wow, the pressure in your blood pressure as a whole has now caused damage to the small blood vessels of your eye.
Wow.
Same way it can cause damage in small blood vessels of your kidney, it can do the same thing in your eye and affect your vision long term. So it's really important to get your blood pressure checked. And more importantly, look, let me tell you what I've said. I've said this to Lakeitha in the past. You know, I have family history of high blood pressure myself. And I really try to do all the things possible. I've lowered my salt intake. I do 150 minutes of cardio a week. I try to be mindful of what I'm eating. But let's just say something happens and genetically I have to take high blood pressure. I'm going to take that pill and not even worry about it. Because at the end of the day, I want to be here for my kids.
Yes.
I want to be as healthy for as long as possible. I've watched my mother do this. She just took the pills and did what she had to do. And she's healthy. She has not had any heart problems, thank God. Her blood work looks good because she's just compliant.
Right.
So it's not worth it to say, I'm not going to take these pills if the consequence is going to be in the long term that you end up having health conditions that you wish, if you could look back and say, I wish I had just taken that pill. So that's what you have to think about. Don't just think about the here and now. Think about 10, 20 years from now. What kind of quality of life do you want to live?
Right.
Do you want to be in your 80s walking around and being independent, or do you want to be in your 80s bedridden from a stroke or a heart attack, or can't remember anything because you've had vascular dementia? That's how I have to think about it. So if I have to take a pill, I'm going to take that pill.
Right.
Yeah.
Right.
Mm-hmm.
Right. Well, Dr. Charmille Hare, I want to thank you so much.
Absolutely.
For coming and talking to us on our Wellness Wednesday with New Mount Calvary.
Yes,
this
ma'am.
information has been very helpful. Even for me as a nurse, I mean, it's just always good to sit down with my doctor friend and just have her break down things to in a whole nother level.
Yes, ma'am.
So I hope you all will take this information that Dr. Hare has shared with us, and I hope you will use it. Use it. And
Yes,
if you have not seen a doctor within the last 6 months or a year, please see a doctor today.
Yes,
Dr.
absolutely.
Charmille has availability. She's right here in Locust Grove.
Yes.
So look her up on Google. Or, Dr. Hare, give them your contact information.
And so if you want to call our office, the number is 770-898-4339. You can also go to piedmont.org and just put in my name in the search bar, and which is Dr. Hare, or just Hare, and my information will pop up. You can actually schedule appointments online as well.
Yes, and I actually love scheduling with her. She's not only my friend, she's my doctor.
Yes.
And it's so easy to get an appointment with her. And if you can't do it, contact me. I'll help you get an appointment with her. I have her right here on my phone. Okay? So anyway, again, thank you so much, Charmille, Dr. Hare. We really appreciate you taking out the time in your day and doing this for us. And like I said, you guys, please take this information that Dr. Hare has shared with us today and use it.
Yes.
Use it because it's very important. You don't want to lose your life over something that could have been treated and taken care of.
Absolutely.
And remember, it don't only affect you.
Yes.
It affects your family as well.
That's true.
So keep that in mind.
Yes.
So again, thank you guys for joining us for Wellness Wednesday with New Mount Calvary. I have really enjoyed myself, and I look forward to seeing you guys again next week. Thank you guys, and thank you, Charmille.